Speed app has helped me to have a structured preparation the core critical care topic, whatever needs to be focused on. Because videos in the Speed were also crisp. There are attached slides to it.
I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Sai Pavan Ganji for scoring rank number 2 in AML in May INISS session 2025 in the Super Speciality of DM, Critical Care Medicine and Intensive Care. Congratulations to you, Doctor.
Thank you, sir. Thank you so much.
It's great and wonderful to have you here and appreciate the time you have taken out and your busy schedule to share your valuable experience to us and for the students. Thank you.
Thank you, sir.
So, can we know your detailed background history from where you started till date, what all you have done?
Sure, sir. Sir, I am from Hyderabad, Telangana. I did my undergraduation from Gandhi Medical College in Telangana itself. Then I went on to pursue MD in anesthesiology at All India Institute of Medical Sciences, Rishikesh. Post my MD, I joined my senior residency here itself. Currently, I'm working as a senior resident here.
Okay, great. So, the idea of doing DM critical care medicine started when? Who inspired you to take this decision?
Sir, actually, if we talk about my internship days, when I did my casualty postings, I understood that I'm more suited for acute trauma or acute emergency care kind of a setting. That is when the interest actually started, but I was not completely confident to take that as a branch. I was open to all the clinical branches that are non-surgical post my MBBS. So in MD, I was fortunate enough to get into anesthesiology at INSS Rishikesh. There, I had a brief critical care posting for around 4 to 5 months. That is when I decided that that would suit me as a person, and I would be most suited towards a critical care setting, and that is where my interest lies. So then I decided on to take that as a branch.
Great. So, uh, can we know what you did after that once you decided to do for this DM critical care? And how did you prepare? What was your preparation strategy to achieve this?
Sir, actually, during our residency period, we had an exposure to the critical care settings around for a brief period of time, like 4 to 5 months. So in that 4 to 5 months, whatever the cases that were available in the or that were admitted in the critical care unit, I used to briefly go through the all the cases, the investigations that are done, and how the patient management was. So mostly in the residency period, I concentrated mostly on the anesthesia part because post my MD, I started to read the core critical care topics.
Okay, great. Now, how many questions do you attend this exam?
So actually, initially I've attempted around 75. Then the moment I came to know that the paper was slightly on the moderate to easier side, I've come down from 75 to 69, sir. Even though I knew that I was able to rule out two options among the four, I still didn't attempt that questions. So I don't know. I didn't know back then that this strategy would work or not. But right now I feel that was a biggest bliss.
Okay, great. Now, what will be your advice for the future aspirants of DM critical care?
Sir, for the future aspirants, I'll tell that concentrate on your residency, whatever you are doing, because it is equally important to answer the 40 questions out of anesthesia that you get. If you are well oriented to the OTs and if you concentrate on the residency, you will be easily able to score 30 to 35 out of 40. Coming to the critical care, I would suggest you use some app that would help you or guide you to have a structured preparation. Because critical care as a specialty, you have so many topics to cover, and in this stipulated time, it would be difficult to go through each and every topic. That is when speed has helped me. It helped me to know the core critical care topics that I should actually focus on to crack the exam. So I would suggest the aspirants to have a structured preparation rather than having it as a haphazard preparation and wider number of wider number of topics. try to cover the core critical care topics that where the examiner mostly focuses on.
Okay, very good. Excellent. Now, time to thank and whom all you want to thank that they helped you build your career from day one till date.
Sir, definitely, if you ask me about the critical care, I would like to first thank my seniors who I have worked with back in my critical care posting during my residency. They were very much committed, and they were very much committed towards the critical care patients, and that inspired and motivated me to take this subspecialty and to choose this specialty. And second, it would be definitely my parents for supporting me throughout this journey, uh, and definitely myself too.
Great. Yourself, that's very important. You need to thank yourself.
And
Fantastic.
definitely, Speed app has helped me to have a structured preparation, like I mentioned it before. The core critical care topics, whatever needs to be focused on, because there's so many topics to cover, and in this stipulated time, it would be difficult to go through all the topics. And the videos in the Speed were also crisp. There are attached slides to it. So whenever I was in the OT or whenever I was busy, I used to just go through the slides so that I would revise those particular topics. That's how
Great,
Speed has helped me.
great, great, great. So, once again, we wish you all the very best and all the success for a great and wonderful career in DM Critical Care Medicine. Best wishes to you
Thank you
all.
so much.
Thank you.
Thank you so much.